Greetings! In this presentation, I will be addressing the indicators and symptoms that suggest the occurrence of a heart attack. This topic is of utmost significance since heart attacks are the primary cause of death worldwide for both men and women. Detecting it early is crucial because the mortality rate can escalate up to 40% from the moment the symptoms begin until the individual reaches the hospital. Conversely, patients usually respond positively to hospital treatment, and complications are uncommon. Hence, early detection is imperative. Additionally, understanding how to prevent a heart attack, managing risk factors, which I will discuss, and averting the recurrence of a heart attack after experiencing one is essential. The first symptom of a heart attack is chest pain, which is often intense and oppressive. It is typically located in the precordial area, around the chest and neck, and may radiate towards the left arm, left shoulder, or jaw. In some cases, the pain may also extend to the abdomen. While this symptom is quite noticeable if the pain is intense and lasts for minutes, it may begin gradually with milder sensations, such as tightness, weight, or burning. Hence, it is crucial to be attentive to such symptoms since they could signify the onset of a heart attack. The duration of the pain is a crucial factor to consider. Even mild discomfort typically persists for several minutes, ranging from 5 minutes to several hours, and may disappear and reappear again. This is especially important to note for individuals with cardiovascular risk factors like hypertension, high cholesterol, smoking, or a family history of heart attack. If you fall under this category, it is vital to be more vigilant and seek medical attention immediately if such symptoms arise. A second symptom of a heart attack is discomfort or pain in the upper body. Unlike chest discomfort, this symptom may occur without significant chest pain. It can manifest as a feeling of numbness or tingling in the left arm, both arms, or one hand. Discomfort in the stomach, back, neck, or jaw may also occur. These symptoms can occur in any order, and it is crucial to be aware of them, especially if you have risk factors. It is possible that a person may begin experiencing discomfort in the neck, jaw, or back, and it could signify the onset of an acute myocardial infarction. The issue here is that the individual may not complain of significant chest discomfort, which should be taken into account, particularly if you have risk factors, and hence be vigilant and seek medical attention immediately if such symptoms arise. A third symptom that may indicate a heart attack is cold sweat. The person may experience sudden sweating and feel cold, even without engaging in any physical activity. This sweating will cause their skin to become clammy, cold, and pale. As the heart struggles to pump blood, the body will divert blood away from the skin, causing it to turn pale. If these symptoms occur, especially in individuals with risk factors, it is essential to seek medical attention immediately. If this symptom is accompanied by any of the previously mentioned symptoms, the situation is even more critical, and prompt medical intervention is necessary. A fourth symptom that may indicate a heart attack is nausea and vomiting. The person may feel discomfort in the stomach and experience a sensation of nausea, which can sometimes lead to vomiting. If this symptom occurs in conjunction with any of the symptoms mentioned above, it should increase suspicions and prompt immediate medical attention, as it may be a sign of a heart attack. Nausea is often associated with other symptoms such as sweating, shortness of breath, chest pain, lightheadedness or dizziness. It is important to note that not all people who experience nausea will actually have a heart attack. However, if you're experiencing any of these symptoms along with any other signs associated with a heart attack, such as sweating or shortness of breath, you should call 911 immediately. A fifth symptom that may indicate a heart attack is dizziness. This symptom is often overlooked, but it's important to note that it should be taken seriously. If you experience any of the other symptoms we've discussed here, chest pain, nausea, fatigue, and you also feel dizzy, you should seek immediate medical attention. A sixth symptom is shortness of breath during a heart attack can be one of the symptoms that you experience when your heart is not able to pump blood efficiently. This may be accompanied by chest pain or pressure, but it can also occur on its own. As the heart muscle is unable to pump enough blood, there may be a reduced blood flow to the lungs and other parts of the body, resulting in the feeling of not getting enough air. The lack of pumping can be caused by the heart attack itself or an arrhythmia, leading to other symptoms previously mentioned. Additionally, reduced blood flow to the brain due to a heart attack can cause dizziness. If shortness of breath is accompanied by other symptoms, particularly in those with cardiovascular risk factors or of a certain age, it is essential to seek medical attention. The seventh symptom is anxiety. The person may tell you that they have a feeling of distress, that they are afraid that something bad will happen to them, but this is not specific. They may be more irritable, emotionally unstable, and may become unstable to cry without motivation suddenly. Or they may tell you that they have a panic attack or a panic attack, which I could have had. But you have to be very careful, especially if the person has cardiovascular risk factors or has some of the symptoms discussed above. It should always be ensured that it is not an acute myocardial infarction or a heart attack. The seventh symptom of a heart attack is anxiety. This can occur in some cases, even if you have no other symptoms of a heart attack. This symptom is not specific to a heart attack but should be taken seriously, as it may indicate the presence of something more serious. It is important to note that anxiety can be a symptom of a heart attack or myocardial infarction, so it is important to be cautious and ensure that your symptoms are not caused by an acute myocardial infarction or heart attack. Anxiety has many possible causes and manifestations. Some people experience it as a sense of distress, fear of something bad happening, emotional instability, or sudden crying without cause. In some cases, they may also experience panic attacks. One of the most important symptoms of a heart attack or stroke is chest pain or tightness. This pain may occur during physical activity or in cold temperatures, and it can be indicative of angina, which is caused by a lack of oxygen supply to the heart. Angina is often silent and often starts years before a heart attack occurs. Therefore, it is crucial to consult a doctor and undergo evaluations such as stress tests to assess any potential risks. The presence of cardiovascular risk factors, as mentioned earlier in relation to the symptoms, increases the likelihood that the symptoms may indicate a heart attack or stroke. Therefore, prompt and decisive action is necessary in the event of a heart attack. The most significant cardiovascular risk factor is age. In men, it starts at 45 years and in women, it starts at 55 years. This is because women have a later onset of risk as a result of the protective effect of estrogen during their reproductive years. But after menopause, their level of estrogen decreases and increases their risk of cardiovascular diseases. Another significant factor is high blood pressure. If you have hypertension or constantly elevated blood pressure, you should seek treatment as it significantly increases your risk of heart attack or stroke. Smoking is one of the most significant risk factors for cardiovascular disease. Cigarette smoking can damage the blood vessels, increasing your risk of atherosclerosis and heart attacks. Furthermore, smoking can lower HDL cholesterol levels and increase blood pressure, both of which are risk factors for cardiovascular disease. Smoking is a significant risk factor for cardiovascular disease and diabetes. Obesity is another risk factor that is associated with hypertension, hypercholesterolemia, and diabetes. Diabetes, in particular, can affect both nerves and blood vessels, leading to an increased risk of developing problems such as cardiovascular diseases. Therefore, it is crucial to maintain proper control of diabetes. An elevated C-reactive protein level is also considered a marker of inflammation in the body and can be a cardiovascular risk factor. Additionally, a sedentary lifestyle is a risk factor for cardiovascular disease, not only because it can lead to obesity and type 2 diabetes, but also in and of itself. Therefore, it is important to engage in physical activity and exercise regularly. Another important risk factor to consider is family history. If your parents or siblings have had a heart attack or myocardial infarction, it increases your risk of cardiovascular disease. Specifically, if your father or brother had a heart attack before the age of 55, or if your mother or sister had one before the age of 65, it also increases your risk. Therefore, it is important to consider family history when assessing your own risk of cardiovascular disease. Stress, although often not included in risk factor classifications, is another factor that can contribute to cardiovascular disease. Being highly stressed, anxious, or having poor sleep habits can increase the likelihood of having a heart attack, in addition to the other risk factors we discussed. Exposure to toxic substances and drugs, particularly stimulants like cocaine or amphetamines, can also cause vasospasm and increase the risk of acute myocardial infarction. Even younger individuals under the age of 40 can be affected by this. It's important to call emergency services right away or go to the emergency room if you experience any symptoms of a heart attack or stroke. Even if you are not sure if it is a heart attack or stroke, it is still important to seek medical attention. Do not delay seeking medical attention, as early treatment can greatly increase the chances of survival and reduce the risk of complications. Remember, prevention is key, so it is important to manage any cardiovascular risk factors you may have, such as high blood pressure, high cholesterol, diabetes, obesity, and a sedentary lifestyle, through lifestyle changes, medication, and regular medical checkups. It is important for healthcare providers to have as much information as possible about their patients. This includes the patient's medical history and current symptoms, as well as any medications being taken or allergies. It is also helpful to share any electrocardiograms that may be available, as they can be compared to the new one to see if there are any significant changes. Prevention is key to reducing the risk of cardiovascular disease. It's important to make healthy lifestyle choices such as exercising regularly, maintaining a healthy weight, eating a balanced diet, managing stress, and avoiding smoking and excessive alcohol consumption. Regular checkups with your healthcare provider can also help identify and manage any cardiovascular risk factors you may have, such as high blood pressure or high cholesterol. By taking steps to prevent and manage these risk factors, you can reduce your chances of developing cardiovascular disease and improve your overall health and well-being. Thanks for watching this informative discussion on cardiovascular risk factors and prevention. Remember, maintaining a healthy weight, quitting smoking, and staying physically active are essential for living a long and healthy life. By assessing your risk factors and taking steps to prevent heart disease, such as stopping smoking, maintaining a healthy weight, or exercising regularly, you can significantly reduce your risk of a heart attack or other cardiovascular events. Stay informed and stay healthy. Thanks for watching. We'll see you in the next video.